Initially, a pilot was set up in the hospital as a direct result of a carer's needs assessment that was carried out, and parents and carers identified their top need. The thing that they wanted help with most when visiting or being in the hospital was help with money worries and advice about money.
There was some resistance around, well, actually I feel money's a really private matter, I don't feel comfortable, but it's about giving staff the confidence of, we're not asking you to sort out somebody's money issues. All we're asking you to do is to raise the issue, and where you get a positive response, make an active referral onwards.
The referrals come in various ways. First of all, if people access services through family support, it can just be a sheet of paper that comes through with the client's details on it. We have advertising throughout the hospital and the solar boards, so sometimes that gives people the information they need to contact us direct. We have leaflets throughout the hospital with the number, and they come direct to me, where people will just self-refer. Sometimes you get emails that will come direct from staff throughout the hospital, and also phone calls from people that work in the hospital that work directly with the patients.
So clinical nurse specialists are in a really special position because they're working closely with the medics, but they're also working closely with the families. They see the families on a regular basis, whether the family has a child as an inpatient or whether they're attending as an outpatient at the hospital.
I think in our job when we see these parents, we obviously are dealing with the child and the cardiac issues they have. So we go through all this with the parent. We give them information leaflets. But also we tell them that we appreciate there's other, concerns that they may have, and we signpost them to sort of family support, money advice, psychology. So how I put it over is I offer them all this information, and I say with the money advice, there is a lot you're entitled to.
We provide the advice mainly in a private room we have here that's very comfortable and quiet. We'll also provide the advice in the ward.
I think for a lot of people that come in and use the service, perhaps things are going on in their life where they're in a situation that they've never had to deal with this before and they don't have any knowledge around it. And so when they're here and they're getting a referral in from someone that they're working closely with and they trust, that are putting them forward to us, they have confidence in the service that we are there to help them.
We've also carried out a qualitative evaluation with parents and carers as well as that clinical nurse specialist fed into that as key stakeholders, which has really given us the opportunity to understand how valuable the service is, both to clinicians as well as to parents and carers.
If people are struggling with their finances, on top of having children that are unwell, sick or critically ill, it makes life even more difficult. And if it's just one less thing for them to worry about, and that's what having this service, does.
Co-location here is absolutely key, and when you examine some of the findings we got from the qualitative evaluation, parents and carers actually talk about that, because they talk about when you're caring full time and when you're spinning plates, you would have absolutely no opportunity to either complete a benefit form or attend a high street service. And actually I think the other thing that demonstrates that co-location works is we build trust and we build relationship with our clinical staff. But secondly, our engagement rate demonstrates that we have an engagement rate here of over 92% with the families that are referred. And the other thing I think around that is the money advisors can be so flexible, because you might have an appointment to see a parent and the child's condition changes very quickly, and so we can be flexible around our approach and move the appointments around to suit the needs of that particular family.
The team make themselves very available, even if I've just to pop my head in it and say, can I make an appointment, can I see you later, are you busy? If they are about there, and if they're busy, they'll give me a time, and I've never ever had a problem. They're just a great team.